A Houston woman secretly recorded her surgery in a hospital operating room while she was under anesthesia. Check this one out.
She's a cancer. She said some choice words to us in the clinic when we didn't book her case within 2 weeks. Really? Including, I'm going to call a lawyer and file a complaint. It doesn't seem like the thing to say to the person that's going to do your surgery. Hi, Precious. This is Precious over here. Saying hi to Precious over there.
I give her a little bit of credit for actually finding a place to hide that recorder because, you know, they're checking everything else out. But I thought to myself, whatever your circumstances are, if you are in a situation where you need to hide a recorder because you don't trust your doctor, should you really be laying on the table and being cut up by that?
I know that.
Although, look, this is my issue in our current society is, like, I'm troubled by this, obviously, very much so. Think clearly you're hearing inappropriate things in the operating room. But it always tends to happen, and this is one of the things I hate when there's not open communication between patients and doctors, is you end up getting like one side of the story, and I'm troubled when it becomes an adversarial thing. And it sounds like, you know, this was a scenario where she needed an immediate surgery, and I think was booked within a few days as I dug into it. And so it's you know, clearly there was tension going into this scenario, and I hate that because but that doesn't mean that doctor was inappropriate in his or her remarks.
Yes.
The people in the operating room were, but it doesn't mean that she was getting substandard care. In fact, had a really good outcome. So that's where I'm troubled, is why does it have to be this way? Why?
You have to understand, and I'm not condoning it, but in the operating room, it's a controlled environment for the staff. It's a little bit like a locker room mentality. Certain things are said and certain things that go on that are not meant to be demeaning to anybody, to be disrespectful, to be unprofessional. We are focused, and we can stay focused, sort of like MASH. They would, you know, make light of this and joke that, but yet that is how we deal with the stress of the situation. And I think this woman felt a little bit like a victim. I think she realized that maybe she was a little tough as a patient, and maybe rightfully so. I don't know exactly all her medical issues, but just going in, she felt like, I'm a problem patient and I'm being treated differently, and she wanted to document that.
I don't practice in an operating room. I'm in the emergency department where everything is open. And so every conversation I ever have, there's people around me, you know, so you're cognizant of it. But when I trained, and this is kind of backing you up, you go into the operating room and just quite honestly, there's talked amongst the staff. I mean, it is an unbelievably weird environment where to get through sometimes these 8, 10, like just the sarcasm, and it's a crazy environment.
No place ever for being unprofessional, disrespectful to your patient, and this is what that appears to.
Totally
but I think
disrespectful.
this is being taken a little out of context. In other words, that you can take those snippets and you can interpret that as very unprofessional.
I mean, it sounded like they were being racist towards her. It sounds like they were being body shaming.
These people were in the wrong. But you're in your clinic, and a patient comes in and demands to have a surgery tomorrow, and it's an impossibility. So maybe you plan to do it a few days later, but the patient says, well, I'm going to sue you, I'm going to get my lawyer. You have to understand that doctors become very defensive in these scenarios, and it doesn't make it right, and it doesn't make it appropriate at all. But it gets back to, I feel like the adversarial nature right now of so many doctor-patient relationships just troubles me.
And it's only getting worse.
Just troubles me. I don't like it.
With managed care, that you've signed a contract to take care of patients that belong to that healthcare organization.
Right.
And I think
you don't get to pick your people.
Yes.
Right, and we don't get to pick you.
I think this is what happened in this scenario, that these two were sort of married because of the system that they were both a part of.
And to me, the healthcare providers should be disciplined. I don't know how it will happen, but I'm troubled whenever you start secretly recording things and then start trying to sue people. If you feel like you have to secretly record it, cancel the surgery, find a new doctor. Don't record it with the hopes of then, you know, I think they're going to say something bad, and you know, it's just the whole thing. I hate this.
I'm going to just take it a step further. If you have to secretly record anyone, you are not trusting them. That is the biggest red flag, and you need to consider doing everything you can to get away.
It's absolutely true.